this procedure and how to do the technology. But before you even get into all the technology, I want to talk about the before section. And we're going to go a little bit more into detail a little bit later on this, but you need to determine your topic. And I would recommend the topics that you're interested in, what you're passionate about, what your patients are asking you about. It could be plantar fasciitis, Achilles tendonitis, could be warts, anything that there's an interest in it. Determine the date that you want to do it, or dates. We tend to do it every other month on the first Tuesday in the evening. That's the time that we found was easiest for us. We wanted to do it at about 7 p.m. We want to do it every other month because every month was a little bit overwhelming for the docs because you have to develop a new slide deck at least the first time you do them. Once you get through them, you could repeat them because there's a new audience. You need to include the slide deck and including the questions. The questions are the things that they ask you. Either they've asked you in the past or what they ask when they're registering on the Calendly link. And then you have to send out these invitations. So we do so invitation is different than a reminder. The invitation is the email. So we send it out via email and text via our medical record. We send it out at 2 weeks, 1 week, and 3 days before, and then the day of the event. That's what we do, and the text message. During some housekeeping items, just to keep, because these are some mistakes that we made. All the doctors should get there 15 minutes before. So if it starts at 7 or 7:30, it should be there, let's say 6:45. I think that's important, especially to have some staff there to help as well. Maybe your office manager, because if it's just up to the doc, sometimes we get distracted when we're talking. Start on time. This is something that's very awkward. So if it starts at 7, I leave a waiting room open and I don't let people in until 7, and then we start. I don't let people in early because it's just kind of an awkward position. There is a webinar function on Zoom if you want to do that so no one can see who else is there. We do one where you can see each other. You can see the other people. But there is a webinar function on Zoom if you want to purchase that. Delegate a co-host to receive questions. We have our office manager on there, and we introduce her and we change the name, and questions can be addressed to her so she can answer and field all the questions. We allow questions. Usually we include the questions in the portion of the talk that we developed with the ones that were asked prior. The ones after, we ask them at the end, and we record that portion as well. We share the slides on the Zoom, basically the same way I'm doing this right now. And you have to remember to hit record. That's a key because you want to record this so you can save it. Even if it's not perfect, you can edit it. And then in terms of modes, what you want this to be on is speaker mode. There's 2 options, and I'll show you that link in the future. But basically on Zoom, there's a little place you can do, I think it's grid mode where it shows everyone, or you can do like the speaker mode. And I find speaker mode is better, and then you can, so it doesn't show everyone else that's in the webinar. Otherwise you have to make one of those awkward little covers to cover people's faces because we didn't want their faces to be on there. I mute everyone except myself. That's key in muting everyone except the doctors. Now, one person has to be the DJ. Only one person can share the screen. So you have to determine who's going to share the screen. Not every doctor, if you have multiple doctors, are going to do it. And I think it's just like a regular event. I'm usually the MC of the event, and I'll introduce my other colleagues. I'll introduce them. I'll welcome them. I'll welcome the guests. I'll tell them kind of what they're going to expect. And then I'll say, we're going to answer questions at the end. So that's kind of the during process. And then the after process is after the event. We email the slides and the recording to those that missed it. What I do is I upload them to my blog, and there's a kind of a neat way with Google Slides. You can actually publish them, and I can show you how to do this later on. You can publish them to the web so they can't download them. And basically all you're doing is it's just like a slide deck that they can't, I guess they could screen capture each and every one, but they can't download the whole PowerPoint. That's a really neat function if you want to kind of hide your slides and not have everyone have access to them. So you can send them the slides so they can look at them, and you can also send them the actual video. And if you want, you could, for example, do a sign up sheet to get it, or an email to get it, or something like that. I add it to the website section. Oh, I talked here also about for those that missed. So let's say someone signed up for it and they weren't able to participate. After, it can give a couple of emails as well. This Calendly does it automatic, and I'll send them a link to that blog, and then I'll upload it to that section. Then afterwards as well, you edit the video into sections and you put it on YouTube. You put like the full length one, and then you put individual sections based on the question. That's what I found excellent. And then we give it out also as patient education information. We use something called Patient Education Genius. I think it's I don't know, it's so much per month per provider. But what it is you can, those individual questions they have or the webinar, you can actually send them a link to that. And it works really nice for, let's say someone comes in for Achilles tendonitis and you don't want to spend 45 minutes explaining it and all the complications and surgical treatments. You can just send them out that webinar and they can watch that at their leisure. Patients really appreciate that. And then if you think about some follow-up marketing, if you do a great talk, one, you can invite people. You can invite other people. Let's say with Zoom, normally we have 100 slots. We don't typically fill those with our patients, so we can send it out to physical therapy places, invite the physical therapists, invite primary cares, invite referring doctors, invite shoe stores, and they can participate or have their staff participate to learn more. And then you also can send it out afterwards to them. You can send them the recording, you can send them the slides so they can review that at their leisure if they can't participate in the actual webinar. So there's a lot of groundwork, and a lot of this can be automated. It can be done real quick, so you don't have to be doing all this stuff.